Welcome to Health Talk. Today we're going to talk about mobile health apps and you. So with us today we have Dr. Mary Rithu Varkey, Brian Lung, and Kevin Liu. So tell us, what is e-health or what is mobile health apps?
Yeah, so in mobile health apps, there's a whole bunch of applications that we have on our smartphones nowadays in order to track our health, manage some kind of disease such as diabetes, or even just to remind you to take some medication.
And we know that there are 325,000 mobile health apps, but 3.2 billion downloads up to now. So it's huge. The market's increasing. They think it's a 20% increase per year. And as of now, Google has overtaken Apple in the number of mobile apps. So the Droid system is on the rise. So tell us a little bit, if you were a patient, or do you tell your patients which apps you might use?
Yeah, for diabetes, we have a couple of interesting apps on the market which are like free of cost. You can easily download it on your Android phone or your Apple. Few of them are named, like My Sugar is a famous one, like most of them would be knowing that. And Diabetes M, Diabetes On Track, and My Glucose Check. These are some of the apps which we recommend for patients. So how these apps work is the patients can usually log on to their app. Like once they download it, they can use their own name or password and then log on to it. And they can actually have their glucose readings entered, like the morning blood sugar values, which they check every day. And also they can also log on their height, the weight, and then that calculates their BMI, which is the body mass index for their height and weight. And they can also enter down their lab reports like triglycerides and all the lipids, and so the doctor can have a log as to what their blood sugars are. It's very important for diabetic patients because sometimes they are on insulin every day and they have to kind of adjust their insulin according to the blood sugar. So they usually have to check their blood sugar in the morning and after they have their breakfast, or at lunchtime, sometimes at night before going to bed. So this will mainly help with patients monitoring the blood sugar, and also the doctor can have an idea of what their sugar trends were the last 1 week. So there are major of couple of apps, and for them, if you have a subscription, if you pay extra, they have additional features like telling on to the patient what diet they can follow. Like they give you all these recipes and what to cook or what to eat, and they also connect you with a community of people with the same, if they have diabetes, they connect you with a group of people. So you kind of feel motivated, and they have all the personal blogs where people write about their success stories on how they control their sugar, how they lost their weight, which is very interesting. As a patient, you would like to know more about the community you are in.
I think some of them are very good now in the sense that they follow the diabetic self-education and management guidelines, which was proposed by the American Diabetes Association for the past 20 years. So they're looking at nutrition, hemoglobin A1C, lipids, blood pressure, weight, and some even do mood, because diabetics can have depression. Not only the disease leads to depression, but sometimes there are microvascular changes in the brain which can lead to depression. There's some interesting hypertensive apps. Can either of you tell us a little bit about that? The high blood pressure apps?
Yeah, so there's a number of high blood pressure apps out in the market. They usually track your blood pressure over the course of however many days that you use the app, and they kind of graph it all together into a giant table for you, so you can show your doctor or another healthcare professional how you're doing over the course of a few months, so they can help you, give you more medications, or whether they can lower your dose, things like that.
So there are logs. There's a log.
Right, there's logs, and they track high blood pressure. Some of them also have extra features that also track blood tests, your triglycerides, things like that as well. But sometimes those are paid features.
Now, nutrition apps are very big too. Kevin, tell us a little bit about the nutrition apps.
Right, so one of the most popular nutrition apps is called MyFitnessPal. I believe on the Google Play Store, it has around 50 million downloads, so it's very popular. So MyFitnessPal is a nutrition or food journal where the users they input what they're eating and also how much, so they can see whether they can see how much they're eating in the sense of calories, or other micronutrients, like for example if they're getting enough calcium, or if they're getting enough vitamin C. So one very attractive thing about MyFitnessPal is that it's very easy to use. It's very user friendly. So I used to teach a nutrition class, and so one of the assignments that we had was these weekly food logs. So one of the gripes or one of the challenges for our students was that they had to manually write in what they ate and how many calories they had. But one positive thing about MyFitnessPal is that they have a database, and you can type in apple, and in the database they will have the apple, they will have how many calories in each serving, how much of vitamin C. So it's already in the database. And also one more convenient feature they have is that you can scan a barcode and it'll pop up what you ate. So a lot of the things that we eat is in packaging. So if you don't know what the name of the food is, you can just look it up through the barcode scanning app, and you can figure out how much you're eating. So it's a good way to track not just how much you're eating, but how much you should eat to lose weight if you would like.
Now there's an app called Ada, ada.com, where you can type in whatever physical complaints you have, like fever, chills, and it's free.
Right. This is an app called Ada, and it was created with contributions from over 100 doctors and scientists who all thought that maybe we should provide patients with a way to kind of monitor their symptoms over time and see what are the potential diagnoses. However, this isn't a solution to your symptoms. This is just a way to check and go to a medical professional right after if you think there is an issue. They'll ask you what is the main symptom that's bothering you. Some of them will ask you if these symptoms bother you over time, and you can answer these questions, and it goes through some sort of questionnaire based on kind of AI, artificial intelligence, to kind of guide you to what kind of issue it might be. And at the end, when it gives you a list of diseases or things that might be causing your symptoms, you can go through and see, these are some of the risk factors, why could I have gotten these, and things like that.
I went on the Ada app, and it's a little cumbersome because it's long. So there's a questionnaire is very long because it goes through every system in your body, head and neck, your lungs, your heart, abdomen. So the decision tree is there, but it's a long, I think it's a breakthrough in medical apps because they're getting more doctor involvement, and we're getting more of a medical and scientific approach. The other thing I thought was interesting about the apps that there are 3.2 billion downloads. Obviously, people want to do this. People want to save themselves the time from visiting a doctor, from going to an ER, going to urgent care. Everyone's very busy. And we as physicians, it's important for us to understand that and be aware of that and try to help our patients with suggesting the correct apps, the best ones that there are. Now, some of the diabetes apps, I noticed that the most popular one that among all of them, paid and unpaid, is Gluco. However, it's expensive. It's $69 a month, and it will send all the data to your doctor. It has charts, and it tracks you, and has alarms. And sometimes this is costly if you're a type 2 diabetic, because for $69 a month, you might as well just check in with your primary care doctor. So as a physician, what do you think about all this?
Yeah, sometimes the cost is a concern, but at the same time, there are free apps too, which you can download. You don't have to always go for a subscription unless you feel it's really necessary. Suppose if your medical condition, warrants you that you have to check your blood sugar every day, and then you adjust your insulin doses. then that might be useful to going for a paid version. But otherwise, there are so many free apps which are available easily to be downloaded, and it's very easy. Sometimes patients can find difficult, especially the elderly who are not so much friendly with using all these devices, mobile devices. So they can always ask their, their loved ones or their grandchildren, or sometimes they are much into these electronic devices, so they can ask them. And how this helps is this actually sends in a report to the doctor, so the doctor can actually monitor your blood sugars. That is very important. And sometimes they also have insulin pump at the same time, like on Medtronics, which they deliver the insulin accordingly. So the app and the pump is connected with a system called as the Wi-Fi. So the app directly sends the message to the insulin pump.
Now, there are also hypertension apps where you can put your fingers there and they'll measure your heart rhythm and your blood pressure, your pulse rate. So of all the apps, the ones that take up the most space is cardiovascular, diabetes, and ophthalmology. As an ophthalmologist, I found that there are something like 62,000 eye apps, ophthalmology apps. Some are free, some are not free, and some are for the iPad. You can now do artificial intelligence, virtual reality, do your own visual field. You take your iPhone, hook it up to a virtual reality headset and do a visual field. And some are iPad. You can do a visual field, especially for those with glaucoma. And there are ones called where it's called the iBook, where it goes through every visual exam that you can have and record it, and goes through every visual symptom that you might have. And it's sort of like ADA, but for the eye. There are also ones that do testing for muscle imbalance. So if your head is tilted, if your child's head is tilted, they'll do a head tilt test. They'll tell you how to do it with your iPhone. So it's extraordinarily interesting because ophthalmology mobile apps has been breaking through. I did my own called Train Your Eyes 101 on iPhone, launched December 2018, and this checks you for visual acuity, contrast sensitivity. So this is something that we feel that helps people who are presbyopic to see a little bit better, or if you're first year law school, to improve your vision so you're not constantly straining at your eyesight. So it's a form of vision training. So check it out, Train Your Eyes 101. The other ones are also involving examining babies using the optokinetic response tape, which is a reflex to see if you can see or not. So there are very many apps out there for ophthalmology, cardiology, and hypertension and diabetes. The hypertension apps now seem to be more diary-based. You journal, you just put in your blood pressure. Many of them do not say what the latest guidelines are for what is normal high blood pressure, so that's one of the problems. So you can't dump your doctor right away. You still have to see one of us. You can't just say, okay, I'm just going to sit in my room and diagnose myself. There are even apps to teach ophthalmology residents how to do eye surgery. So we don't suggest you doing your own eye surgery either. So this is important. The most important breakthrough, I think, in cardiology is that you can check your own rhythm, especially for people with atrial fibrillation. You press it on. It's a paid one. You do have to pay. There are ones that are free where you can press your thumb down and find this. Apple iPhone, the latest one, and the Apple iWatch, they will also check your heart rhythm for people who are worried about rhythm disturbances. For blood pressure, again, be aware that the normal is less than 120, the upper number systolic, and less than 80 diastolic, the lower number. So none of the apps tell you that. So still, you have to call your doctor.
So I just want to add on to your point about the guidelines. So actually, in the Play Store, Google Play Store, Apple Play Store, they actually have mobile apps, whether published by the AHA, American Heart Association, or the ADA, American Diabetes Association, that publishes all the guidelines but in a mobile app. So it's very useful for the general population, but also for clinicians and people who work in healthcare, instead of having to look up, these guidelines, that they have an app and they can just punch in the search and see, oh, what is hypertensive in the app, and it'll pop up the guideline that they're looking for. So also there's educational applications on the market, whether it's for clinicians to have assistance and also the general public to research on their own condition as well. Those apps are available for the public.
It's still unfortunate that they're not in all multiple languages. The most is Spanish. And so there's not that often in Chinese, Korean, Japanese, and all the other sub-languages. And when they did the last U.S. Census in 2010, that the ones who speak another language, who are bilingual, Korean is spoken a lot at the home, even though they are Korean Americans, and Vietnamese is spoken a lot in the home, even though they are Vietnamese Americans and they are U.S. citizens. So there is a sector of the population, although small, because Asians make up 4% of the American population, they have disease. So they're the ones who do come to the ER, urgent care, and sometimes it's very important to know some of their statistics. In UC San Francisco, about 5 years ago, they developed a translation app. So if you come in with a chief complaint that I have chest pain, it'll translate in all the 166 languages. So that is, there are apps for that. You can go on Google Translate and do that as well. So if you go to an ER, let's say you're an American, but you're visiting Bangladesh for fun, or you're going to Vietnam and you're an American, you don't speak Vietnamese, but you have chest pain or your defibrillator is not working. So there are these capabilities on your iPhone, smartphone, Droid, to help you navigate. Or you're in France and your pacemaker is not working, there are people that will translate. And it's important for all those people with defibrillators, pacemakers, that of course you know to carry your card, but rest assured that in whatever country you are in, the pacemaker reps of Medtronic, Johnson & Johnson, they will come to the emergency room, or they have 24-hour service across the world. So that's very helpful to people who are traveling. The only thing it doesn't help you if you're on a camel in Tibet and you're in the middle of a desert. Then you have no phone connectivity, but so it's good for most people who travel to major cities across the world. So other things for your patients, what might you suggest also?
Yeah, for the apps, regarding the apps, I would suggest, like, if they're comfortable with it, and if they are, like, they can have a trial run, like, you can ask them to just go over, if there is somebody at home, like their grandchildren or their kids even, can go over the app, like what exactly, even for the elderly. And if they're comfortable, then they can start using the app. And at the same time, they must also have knowledge about what the symptoms of diabetes are, just not rely just solely on the app. That's what I would say. Though the apps are a recent advance and they are more helpful to us, we must also rely on a doctor for the symptoms. So in case if they have a chest pain, or if they have something, if they know that they have high blood sugar, they should go to a doctor and see, just not rely on the apps.
There are mobile apps for you for free, to log on where you are. So they have it's an actual GPS device. So if you fall down, they'll detect and they'll call 911. So all these exist, and it's also in the latest current version of Apple Watch. And there are also apps that you can list all the various medications, so it pops up and it will remind you with a ringtone. And there are also ones that you can enter in all your emergency notifications, such as your allergies, your pacemaker number, make, model, defibrillator, because if it kicks off and you're in an ER in France or Germany, there's a way for people to access it.
Yeah. There are also other apps that help people get lower copays for medications as well. There's an app called GoodRx, and there's also other ones made by local pharmacies that kind of tell you oh, if you have issues paying this copay, we can have coupons downloaded to your phone and you can show the pharmacist. So it makes things a lot easier for patients. In addition, there's also other apps that tell you these are the dosages, be aware of these side effects, and some of them even have a option to scan a tablet and they can identify the pill for you. Yeah.
Right, and just to add on, since we were talking about money saving, so actually there's a program that's sponsored by I think it's also the state and federal governments, and so the elderly people 65 and older, they actually may qualify for assistance on their phone bill, and they may get a free phone. I know that my grandpa, he never had a phone until like literally like a couple months ago, where my sister signed him up for a program that helped him pay for a phone and also for the data service. So especially in the aging population, whether it's not necessarily technologically friendly, or that they feel like it's not necessary to have a mobile phone since they've gone through so much of life not having a mobile phone. But I just want our home audience to know, 65 and older, that there are programs out there that might help them purchase a phone if they would like. So check if you qualify for one of those programs.
Yeah, and all the things that prior authorization, sometimes your doctor gives you a medication and that your Part D pharmacy insurance will not pay for it, or your insurance will not pay for it. If you type in the medication, the branded medication, and type in coupon, it usually will come up, and you can either print it on your computer or it will go to your phone. Because many of these medications that need prior authorization, you can at least get a 1-month supply for free. And after that, then it's maybe more cumbersome, but maybe you only need a month's supply because your doctor needs to see if it works at all anyway. So look at using your smartphone device not only as a Xerox machine to take a copy of all your medications, but also as a way to download these things to present it to a pharmacist.
That's an important point too. I would suggest that patients should know what medications they are on, also have a list of their own, which they can take it to their own doctors. If they have like 3 or 4 healthcare providers whom they see, then everybody must have be on the same page and have the list of medications updated to them.
And that the pharmacist will become your favorite pharmacist if you call them and say, I have so many medications, can you be the one always assigned to me? And therefore you can get alerts on your phone, or they just call you, or they text you, or they text your favorite grandchild who will then call you, or your daughter or son who takes care of you, or your caretaker, so that the reminders are coming to you rather than you have to go every week to go pick up all the different medications. They will bundle them up for you. CVS has the multi-dose, multi-pack system, which is free, but you have to pay all your co-pays all at once. And there's also Pill Pack, where you can sign up for free. It was bought from Amazon 2018 for $1 billion. So you know that if Amazon's behind it, it has enough money to pay for your delivery. There's also Now RX, which if your doctor fills the prescription through Now RX, it will deliver the prescription to you, to your house, so you don't have to go. Sometimes as we all have more birthdays, we may not have access to a car, or you're no longer able to drive. Having the medication delivered to your house would be extremely useful. And as this is Silicon Valley, we know that there are all these deals for free smartphones. If you qualify, if you turn in your old one, you can get one of your grandchildren's old smartphones traded in as yours, and then you get the latest one that you might need. So the take-home message for our home audience, we should tell them, look at your smartphone as a little mini computer to help you, because there's mobile apps that will remind you, give you a ringtone, or you can have your son or grandson record their voice, so you hear their voice every time you need to take a medicine, and call the pharmacist to ask if that pharmacist can be your designated pharmacist. If you have 5 pills to take every day. Make a list of all your medications, regardless whether you have a smartphone or not. So make a list. Photograph that list on your smartphone so you can show it right away under photos. So instead of your favorite grandbaby picture, you have your favorite list of medications, all 15 of them, because every doctor will want to see that. Also, while you're at it, photograph the list of doctors, because the doctors may want to contact each other. And sometimes it's very hard to remember all the doctors' names. It's enough remembering all your grandchildren's names and their birthdays, but your doctor's names are important. And to have their phone numbers. Have emergency information like your allergies prominently displayed. And the #1 app for diabetes is My Sugar. The #1 paid app for diabetes is glucose, and the #1 for hypertension is called
Blood pressure.
blood pressure, and the #1 for nutrition,
MyFitnessPal.
MyFitnessPal. And try out my mobile app for training your eyes called Train Your Eyes 101. It's on iPhone. Thank you very much for joining us. And if you like KSAR, please make a donation. Thank you very much.